So Vyvanse is unique in that it has a lysine chemical that's bound to it, and that makes it pharmacologically inactive. Welcome back, Straight Talkers. Today I'm going to talk about the medication Vyvanse so that you can be better informed when deciding whether or not to start this medication. But first, make sure you hit that subscribe button so that you can be the first to know when new content comes out. Vyvanse was initially approved for medical use in the United States in 2007, and by 2018 it was the 82nd most commonly prescribed medication in the United States with more than 10 million prescriptions. So how does this medication work? Vyvanse is a stimulant medication, and it works by increasing the activity of the neurotransmitters dopamine and norepinephrine in certain parts of the brain. So Vyvanse is unique in that it has a lysine chemical that's bound to it, and that makes it pharmacologically inactive. And so the medication remains inactive until after oral ingestion and the enzymes in the body cleave off the lysine chemical. This then will convert it to the active dextroamphetamine form. So what this means is that those who are looking to abuse it can't get high by snorting or injecting the medication, which lowers the risk for diversion or abuse. In adults, Vyvanse is FDA approved for the treatment of ADHD and binge eating disorder. And it's also approved for the treatment of ADHD in children ages 6 and older. And it's commonly used off-label at times for the management of obesity, treatment-resistant depression, and narcolepsy. Vyvanse is long-acting, with each dose lasting approximately 12 to 14 hours. And it comes in a capsule that can be opened and mixed with orange juice, yogurt, or water. It also comes in a chewable form that's strawberry flavored. And dosing is commonly between 10 to 70 milligrams per day, and the goal of treatment is complete remission of symptoms. And interestingly, amphetamine makes up only around 30% of Vyvanse, which means that it's much less potent than straight dextroamphetamine. And generally, whenever we're making the switch from one amphetamine product over to Vyvanse, you typically have to double the dose. However, regardless, if I'm using this medication in kids, my approach is always to start low and go slow, meaning that we start at a low dose and increase the dose gradually and slowly over time with the goal of finding the lowest effective dose. Now let's talk about potential side effects. It's important to realize that many side effects are often dose dependent, meaning that the likelihood of getting them increases as the dose increases. Some are also time dependent, meaning that they begin immediately upon starting the medication or whenever we make a change to the dose of the medication. But what we typically see is that they go away with time as your body gets adjusted to the medication. When comparing Vyvanse to other amphetamine products, it's believed that it might have a smoother onset and offset, which may lead to a gentler side effect profile than other amphetamine products. The common, but usually more mild side effects of Vyvanse include things such as decreased appetite or weight loss, insomnia, upper abdominal pain, irritability, vomiting, nausea, dry mouth, or dizziness. More serious but less common side effects could include slowing of growth in children, cardiovascular events, increased blood pressure or heart rate, mania or psychosis, and peripheral vasculopathy. If you or your child are experiencing any of these side effects or any others that weren't discussed, please talk to your physician so that they can work with you on determining the next appropriate step of action. Thanks for watching this video. Now head on over to the next one to find out more ways that you can help your child live their best life.